This was a joyous moment for communities in Kailahun district who have been battling hard to access basic health facilities in this part of the country. It is no gainsaying that access to health facility is a major problem for rural communities, especially here in Kailahun and Sierra Leone as a whole. Bearing this in mind, Sierra Leone, with support from the United Nations Development Programme and funding from the Japanese government, have handed over 6 maternal child health posts to the people in the districts. 4 among the health posts were constructed, while 2 were rehabilitated. The handing over ceremony, done in Luawa and Kissi Chiefdoms, in the presence of the UNDP country manager and representative of Kailahun district, as well as officials from the Ministry of Health and Sanitation, was a moment to reflect back on the health situation before this time. Sierra Leone country manager, who pioneered the construction work aimed at improving rural communities in terms of accessing health facilities, was happy while explaining to the media.
We have been able to construct 6 health facilities. Each of these health facilities have like a staff quarter that can accommodate 2 nurses and their families. We have water system in place but not connected to the health centers. And then we also now need to be able to have solar that can make sure that there is light in the health facilities. So this has been a very tough journey for us because we have resources that we got from UNDP with the support of the Japanese government. And so we've been working so hard to make sure that this facility is like the way you see it today. And so we are so happy that we have been able to launch it today in Mendekelema, another one in Bandajuma, another one in Talia. And the rest of the other facilities we have already handed over to the district council and the district health management team. It is our goal that this particular project that we have implemented will contribute to make sure that pregnant women and lactating mothers have access to better healthcare services.
The project, entitled Building a Resilient Community Health System to Prevent Infectious Disease in Post-Ebola Country Sierra Leone, and implemented by Sierra Leone, has 3 main components, including governance, livelihood, and health. The governance component comprises village development and facilities management committees, which support the project monitoring and reporting to Kailahun District Council through the councillors and other community stakeholders. The livelihood component supports gender-sensitive trainings involving women in governance and businesses in Kailahun districts. The health component supports the rehabilitation and construction of health facilities in 6 towns in 3 chiefdoms of Luawa, Kissi, Tongi, and Upper Bambara. Previously, before Sen's intervention, private homes were used as health centers in these communities, but with the provision of these new health facilities, such will be a thing of the past. After expressing his happiness towards the implementation of the project, the UNDP country representative was plain in his words towards the implementation of the project.
From what I'm hearing from the communities, from the level of reception we have received, I'm confident that the community is very pleased that these facilities have been built. I have gone into them, I've seen the infrastructure, and I think the infrastructure will accommodate the needs that the community has. So I'm pleased with the way it has been built by our implementing partner.
Commenting further on the upgrading of the health facilities in providing solar electrification and water supply systems, the UNDP country representative urged the communities and partners to ensure they maintain the health posts and see how they can provide more assistance.
My hope is that the communities will continue to work together to use these facilities, to maintain them, and we'll work in partnership to see the areas that need upgrading, electricity, getting the water system into the facility. This will be fundamental to ensuring that the health of the people of this community and the other 6 communities we have installed these facilities in will be improved.
The Chairman-Kailahun District Council, Sir KEKE LAMIN, was full of praise and appreciation while thanking Sierra Leone and UNDP as well as the government of Japan for providing the assistance. He urged communities to take full responsibilities in protecting the health post while calling for more assistance.
on behalf of my council and my people in the district, specifically to the 6 communities, we are appreciative of what they have done. We're only hoping that and still asking that they make provisions for lights, solar lights, so that can enable the staff there to do their job very well.
Paramount Chief Member of Parliament representing Kailahun District, PC CYRILL FORAY GONDOR, highlighted the many interventions of Sierra Leone in the district. As local authority, the Paramount Chief Member of Parliament called for proper management of these health facilities now that they have been handed over to the communities.
Una take this health post as una own pikin, now una own property. Now UNDP give fund for let them make and send implementer. But as I say, not to them get for can user. Now for we they don't want. I want to say, even though the structures are very good, I want to appeal to the district council and also send foundation. This is structure. We want to see the necessary drugs that we for day at this health center. We will service the people there.
These health facilities are expected to benefit more than 16,000 inhabitants in the Luawa and Kissi Chiefdom in the Kailahun districts. The newly constructed and rehabilitated health post will now ensure community people get the required drugs, services, and qualified medical staffs to man the post. The ceremony was climaxed by the display of respect and appreciation. The head of Sierra Leone and UNDP were crowned as local chiefs and publicly dressed in African regalia. Compiled by Ishmael Kindama Dumbuya, this is Mohammed Kone reporting.